welcome back. This is another episode of Radio 22's Talk 22, the radio show hosted by me, your boy Mizzle to the Jizzle. We back yet again, giving you a conversation that you want to talk about, and we give it to you with nothing but the real. And this is a real deal conversation here today, y'all. We thank everybody that tuned in last time and gave us the conversation that we talked about so many important things. And I think all of that was important that we gave, but this conversation is really where it's at, because I feel like this is, it's just getting out of control and ridiculous, and we just need to find out more about this. And the subject that we're talking about today, you know, I look on the news and I see so many stories between the stuff of the presidential election and all these different things, but the big story of the day is coronavirus. A lot of us, it's a thing that everybody's talking about, but don't really want to talk about it. Some of us is over it. A lot of us feel like we're over it, but you can't be over it because it's going on like right now. So this is something that's important. And I think a lot of people maybe want to ignore it and feel like it's just going to disappear and go away. But it doesn't just work like that. And I feel like this is an important conversation. And I feel like we just all need to sit down and chat about this. So I appreciate everybody for tuning in and checking this out. And we hope to hear a lot of your conversations in the chat. Please feel free to leave us a conversation in the chat box, and we want to hear from you on this. But I want to introduce my panel today. I got some experts on the line that work in the medical field, at least two of them. And I want to introduce them at this time. I have, out of the Lake Geneva area, I have Dr. Sean. Dr. Sean, please say hello to the people.
Hi, I'm Dr. Sean. I'm an emergency physician and have a master's in public health and medical director for a lot of fire, EMS, and disaster response agencies across Wisconsin. So happy to be on here and help answer some questions.
And we thank you for coming to the show, Dr. Sean. As well, we have out of the Green Bay area, I have Annie. Annie, can you please say hello to the people?
Hi, everyone. My name's Annie. I'm a nurse manager on a COVID unit at in a hospital in Green Bay. So thanks for having me.
Thank you for being a part of the show, Annie. This is wonderful. And last but not least, I have also in the Green Bay area, I got Jesse. Jesse is here. And can you please introduce yourself as well?
Hello, everyone. I'm Jessie. Actually, I've been hit by COVID, so not a professional around the area, but just got out of the hospital 2 days ago, so it's ringing right home with me. So nice to be here, Mizzle. Thanks for having me.
Thank you for being a part of the show, Jessie. I think we're going to learn a lot from your experience here. I want to start the show with just going more into the Jessie's experience here. Jessie, when you first, got COVID, how did you get even introduced to the fact that you even had COVID? Can you explain that to us?
Great question. So I had a family member that was out social distancing, and they were outside at a gathering of maybe 5 people, and they ended up bringing it home to the family. So my dad got it, I got it, my mom got it, my sister and her husband got it. So there were all different variations of how bad we got the COVID. We've all been staying home since March, and now all of a sudden just one exposure led to 5 of us getting COVID. And today would be day 20 for me. I got my positive test result on October 1st. So it's been 20 days of just craziness.
Wow. Okay. Can you explain to us, how did you know that you had it? Like, did you start feeling some symptoms?
Oh, yeah. My dad started first with a couple symptoms, but then you get this barking cough, I'll call it. It's not even like you're like fluid or anything in your lung. It's like literally you sound like a duck barking. It is just a really heavy, hurtful cough in your chest. And I didn't start with the fever right away. The fever kicked in about 3 or 4 days later. and it ranged from 99. My highest was about 103.5. So it steadily increased. I had the sweats. I had freezing. I was just freezing. I'm not a little girl. So, I was putting on blankets, 3 blankets at a time, and just shivering, shaking it out. And then all of a sudden you start with the sweats, the fever spikes, and then it's a terrible feeling. So.
Okay. So at that point, did you get tested right away?
I got tested 2 days after my dad did. So he got tested, and then on October 1st, I got tested. It took about 2 days to get our results back because it's quite busy here in Green Bay. So it took about 2 days to get the results, and my sister and I tested positive on the same day, and about 3 days later, my mom tested positive.
Wow. So when your mom tested, did she test right away, or did it take 3 days until she tested positive?
Yeah, but her doctor's office told her to give it a few days because not all the symptoms were appearing at first for my mom. Okay. So they said, well, just give it a few more days. But by that time, she's been exposed to my dad and myself, and she has lung issues to begin with. So by the time she started exhibiting some of the signs, it was getting pretty bad. And actually, she still has it right now. I'm sure she would test negative, but she's still sweating. She still has problems breathing. We're very, very tired, all except for my dad. But we're just really lethargic, and you don't want to do anything. And for me, it's really hard to still breathe. So.
Wow. Okay. So when you went in, you end up going to the hospital after you tested positive?
Well, the first week was okay. I kind of poo-pooed it, I'll say, a little bit by saying it was like a touch of the flu and a cold at the same time. So the first week was like, oh, everyone's been sicker than this. But then it takes a dive. And at that point, that's when the shaking started. That's when the sweat started, the fevers. And eventually I went into the hospital on the 9th of October because my oxygen stats started dropping. Now, I've had 2 widowmaker heart attacks, so when my oxygen drops below 90%, they say get help right away because that's pretty low. It started going down to 88, 87. So I went to the emergency room, and they discharged me the same day saying, well, just take it easy. About 2 days later, my oxygen stats dropped down to about 79, 78. And that's when I was really feeling it. And I knew I was in a real tight ship at that point. I needed to get help. So I went back to the emergency room, and that's when I was in the hospital for 7 days.
Wow. Okay. So then how are you feeling at this time?
I'm trying to get up and get a little bit of walking in, but when I say walking, I mean that I went to about 150 steps outside my house yesterday to move my car, and I came back in, and my oxygen dropped from 90 where it was at down to 78, and then it started to build back up a little bit at a time, and it went up pretty quick. But when you drop down to 78, you start getting a little lightheaded, and your breathing is very labored. It feels like you just ran, and you can't catch your breath. I also had pneumonia that produced with this COVID, and they described me as having acute respiratory failure with something else. I don't know how to pronounce it, but with no oxygen, but okay carbon dioxide levels or something. Dr. Sean would probably know what I'm talking about. But when I was in the hospital, there were a few days that I didn't think I was making it because the breathing, to the point where I would wake up at 3:30 in the morning and my stats were down, and they had given me 5 rounds of remdesivir. Is that how you say it? And also the plasma. So I was lucky enough to get that. but it has been an ordeal. And again, I got out on Saturday, so it's slowly coming back.
You're feeling a little bit better every day, huh?
Right.
Okay. I want to ask real quick, Nurse Annie. Annie, for the people at home who don't know, what is a normal oxygen saturation for the people who don't know of the medical world? What is a normal oxygen saturation?
High to mid 90s, I would say.
So anywhere
would be
between mid
normal.
90s to 100, that's normal for most people.
Yep.
So for her to say that she's down into the 70s, that's quite low. Okay. All right.
It's very low.
So yes, Jesse. So at this point, have you taken another COVID test to know if you are free of it?
I haven't. They said that after 10 days of, I guess it's no symptoms, or after a certain amount of time, you end up you're not contagious anymore. But I still wear a mask if I'm around my nephews. I don't want to guess things. I don't want to take things for granted. I still wear a mask. I'm still washing my hands. I mean, I still don't want to go out of the house. Again, it's only been a couple days, but even getting out of the hospital room and being, excuse me, transported out of the hospital, anyone I walked by, I was, they were covered, I was covered, and it's still a scary thing. A lot of people are, kind of blowing it off and saying, well, it's been since March since this has been going on. This isn't real, or this is fake news, or a political, statement. And really, until it hits someone, it may seem like that, but when it hit 5 people of my family, and we've had friends of our family that have also been hit by this, I've known probably maybe 20 people so far that have had COVID. So, I mean, it's no laughing matter.
So was any other family members hospitalized?
My mom went in because she had in the past had pancreatitis. So her potassium levels and things like that were down, but I got hit the hardest. I got the COVID with the respiratory issues. There were also GI issues that went along with this that we all got, that I'll save you details on, but that wasn't fun. But there's many different, and I'll say different levels with what hits different people. My sister had it for about 3 days of symptoms. My dad for about a week and a half, and he's able to go hunting for 2 hours with the dog. Whereas my mom still has symptoms, and I was hospitalized for 7 days on oxygen the whole time, got different trial, testing and, plasma and tests every single day. And I'm still to this point trying not to cough, and the migraines were terrible. I mean, it's just a whole slew of just, symptoms that go on that you just don't even think about until you have it. And you're like, holy cow, I didn't think about that. So
yeah, you sound like you had all the classic symptoms there that they describe.
Right.
And for those of you at home who aren't familiar with that medical jargon, when she says GI, she's talking of the bowel area, having those type of problems. Yeah, you don't want that. But anyways, we want to thank you, Jesse. We know that you are still recovering and whatnot, so we don't want to hold you, but we thank you very much for sharing your situation, and we wish you the best and hope that you can recover quickly.
Well, thank you for having me. And I really appreciate everyone for being on here. Annie, Dr. Sean, Mizzle. I mean, just thank you for sharing my story and letting the word out that this isn't something to be underestimated. That yes, it has been going on for so long, but it needs to be addressed, and it's going to take time, for it to pass. So thank you, everyone.
So thank you for coming.
Thanks. Goodbye.
All right. All right, so I want to go next to my two other guests here on the panel. I want to ask um, Dr. Sean, um, you know, so much of this was made up with when Donald Trump, I guess, said that he had COVID and whatnot, but like so many of us had doubted the situation because he walked away after like one day, I guess, and I never heard of anybody having it for one day. Uh, I
Mhm.
guess I will ask Dr. Sean, can you have COVID for one day?
Sure. Yeah. Thanks for having me on. And a couple of the interesting things that I've heard to answer that question with regards to Donald Trump, from based on what he said and what doctors are reporting about him, is that even though he apparently had mild symptoms, because he's the president, he received a lot of the treatments that it sounded like Jesse received, which are usually reserved for the most critical patients that are going on a ventilator and very sick. But of course, he was put at top of the list to get those things, which may have assisted in how quickly he recovered. But one of the other things that Jesse mentioned too that could play a role is that everybody is going to get a different severity of illness and different group of symptoms. And the fact that this thing is this strain of it is new and everybody has a different illness and there's a variety of symptoms all contribute to a lot of the confusion and maybe thought that this isn't real. But it definitely is. And like Jesse said, if you're fortunate enough to think that this isn't real because you and the people that are close to have not gotten really sick, then good for you. But you only have to get it or know someone who's gotten it to take it seriously and know that it exists. And when I hear those kind of things, I just think back to I don't know if those people who think that that's a hoax, which I can somewhat understand, you're getting misinformation and it's been politicized, and everyone now in these days can give their 2 cents in the opinion regardless of where they're getting information or what their education is, but she touched on a lot of good points, which is, and I thank her for telling her story. Number one, you can kind of see how scary it is. You can imagine if you have some of these symptoms where you don't feel like you can breathe, your oxygen is really low, you're hearing things about how other people are dying from it, how they're having to send in the National Guard and they're shutting down all these places, and places like New Jersey and down south where lots of people are sick.
Yeah.
Just being told you might have this, or you're around someone who has it, or you have the diagnosis, you think, well, I could die, So it's a very scary thing. But she mentioned, that that several people in her family have gotten it. And I hear that time and time again. And actually, a lot of people that come into the ER, they come in with several of their family members, and several of them have it, and several of them get admitted to the hospital at the same time and are on ventilators at the same time. It's a scary thing, and that obviously helps prove what we know from science and other diseases, that this is transmissible, it's infectious, it's contagious, and being in the same area with other people get it, so it makes sense that people in a household would get it. And I know you have a list of questions that I could go on a rant here based on what she said. It kind of brought up a lot of important things that.
Yeah, I think you answered a lot of that, and we plan on going into a lot of that. I guess I'll move into the next question. I'm going to ask you, Annie. With all that Jesse just explained to us, and Dr. Sean as well, we thank him both for those comments. How can we avoid getting sick with this COVID-19? What are some things we can do to avoid getting sick with COVID-19?
Well, hand hygiene is always the number one way to prevent infection. Masking is very important. It protects you and it protects everyone else. If you may be positive but not have symptoms, it's going to protect everyone. So those are the two, I think, main ways to prevent it. And then at this point, when our community spread is so high, you have to stay home, you have to social distance, and you have to be responsible with your actions. That means avoiding crowds, only going out for necessities until we can get this a little more under control in our area.
Okay. Now, Dr. Sean, Annie just said something that I think a lot of people question and a lot of people talk about. Donald Trump was one of the number ones that kind of publicized the whole mask situation. What is the purpose of wearing a mask? I mean, at first they said, leave the mask to the medical people. Then they said, no, maybe you should wear a mask. Then they required everybody to wear a mask. Then there's some talk that the masks aren't even all that effective.
So, I can.
The mask.
Yeah. So the thing I want to say about COVID is we're applying rules of epidemiology and healthcare and, personal protective equipment, we call it, which is, barriers that we wear, things that we wear to help prevent us from getting diseases that are contagious. We're applying the same rules to this as we do to things that have been around for a long time, things that we treat people in the hospital for all the time, anything from a cold to the flu to tuberculosis to meningitis. We know that certain forms of protective equipment, such as certain types of masks, work for certain things. So we know, the more we learn about COVID, the more we know how we can protect ourselves from it, treat it, how it's transmits to other people. But the thing is, every time you have a new strain, just like if you remember H1N1, that's a strain of influenza, like there was, H9N5, and there's all different strains, and each strain behaves a little different. What's the problem with this COVID right now is it seems like it's mutating really fast, just like the flu. So, that's why you get the flu shot every year if you're at high risk for getting a severe flu, because by the time the next year comes around, when the flu season comes, you may not be immune to it, even if you've had it before. So right now, we think, yes, you can get COVID again, and that's because it's mutating like most other viruses do, like colds do every year. You don't just get a cold once and never get it again. So it is important to try to protect yourself from this. What we know, and part of I think the confusion is we are learning things as we go along. It started off with not knowing a lot. We learn more and more. So as we learn more, the recommendations are going to change, which creates confusion and doubt. And people say, well, now you told us this before you told us that. Most colds, including other forms of coronavirus, not COVID-19, but other early forms, which are a common cause of the common cold, are spread by droplet precautions, which means big enough particles when you cough, sneeze, touch someone, stuff that you would say, someone sneezed on me, you can feel it on your arm, that kind of thing, where if you're only a few feet from somebody is the only time really where you're going to get it. Once something can transmit through the air a lot easier, smaller particles, they call it airborne. It means, it doesn't just, you sneeze and those particles fall and they drop to the ground and now they're not going to, affect anyone unless they go and touch it. But when something's airborne, it travels farther, it lingers in the air. Now you can get it after a longer period of time, after somebody who coughed or sneezed or even just breathed has left that area. And over time, through tracking everybody who get it, how they got it, we learned that this is airborne. So those are two different kinds of masks. Droplet precautions mean cover your mouth or have any kind of barrier. So when we say face coverings, it's any kind of barrier to keep those droplets from going. Something like that, or what we call it, a surgical mask, any type of cloth or paper. Once we know that it's airborne, then we get a little more, particular, and that's the N95 mask. It means that it blocks 95% of particles that go through the air. And that's kind of what's always been our standard precaution for other things that are airborne, like types of meningitis and TB. Initially, that was the recommendation then. But what we discovered is we don't have enough N95 masks. Just like for some reason in this country, we don't have enough of common medications that we should have that we run out of. We don't have enough ventilators for when we have a pandemic of this size and a bunch of people need it more than how many people usually need it. So then what we can do is the next best thing. It doesn't mean it's as effective or it's going to completely protect you, but it's better than doing nothing. So now any type of face covering, a surgical mask, is better than doing nothing. Does it protect you 100%? No. And the reason that's important to know is, does it help? Yes. Is it worth doing it so we decrease the chances that people get it and it spreads? Yes. But does that mean that you can just have no precaution, no safety, and just stand around a bunch of people in a closed space with the protective mask and think that that's not going to spread it? That's not true. So it's good to know that so that everybody can kind of take their own calculated risk, know what risks they're taking.
That's very interesting, man. You just dropped a lot of knowledge on us there, Dr. Sean. The whole time I'm thinking like this is doing something for me. So you're telling me
it's doing something, but it's not like, 100%. It's not going to protect you 100%. you still have to take
50%?
I don't know that you can say a percentage, it's just the more things you can do to reduce your risk, the better. So, it kind of gets into our number earlier this season, it was all about, how many people can be around each other, what kind of activities should I do? And there's no yes, right or wrong answer. It's just being aware of what level of risk you're taking, what's higher risk, what's lower risk, and what are you willing to do, and who are you going to be around, and what are their risks, so that if they got it, how sick do we think they would get? So if you're a bunch of teenagers and you don't go around any grandparents or people with chronic illnesses, and you think, well, my chances are that I'm not going to get a severe illness, then maybe you're willing to take more risks than if you go home to somebody who already has diabetes and obesity and chronic kidney disease and has had bad bouts with pneumonia before. You probably don't want to take really hardly any risk of giving it to that person. So it's unique for everybody. Everybody just needs to kind of be educated and try to make smart decisions, but not only for themselves, but for anyone that they're around, or in their community that they could spread it to.
Okay. Annie, I'm going to ask you and have you touch up on the importance of mask wearing, I guess. When I think about masks, I think about like, okay, so when they explained how HIV came about, when it came about many moons ago, one of the ways that they explained to everybody to help protect us from HIV was to wear protection, right? To wear your condoms and different protections like that. That was things that we could use to help protect us from getting that infection. I kind of related the mask wearing in the same kind of way as the protection that we had to use against this infection. Do you kind of see it the same way? I mean, what is it? Can you explain a little bit your thoughts on the importance of wearing a mask?
Yeah, I think it's important to protect yourself by wearing a mask, but even more importantly, it protects everyone else around you. So that's why it takes everyone to wear a mask. And if I'm coughing or if I have droplets coming out of my mouth, if I have a face covering, it's going to protect you. So I think it's not just for ourselves to protect us, but it's to protect everyone else. So I think that's important for people to understand too.
Okay. All right. So going a little deeper into the conversation there, I want to ask.
Can I give you a quick comment, just something to add to that?
Yeah.
There's this notion out there of herd immunity, and a lot of what I see on social media, people are kind of having a good discussion about, and it's good to have a discussion and try to educate each other.
That was actually going to be my next question. My next question was going to be, is this just natural selection in action?
Well, that's a little different, but the idea of herd immunity is a real thing. It's why we get immunizations as a child, is that not only do you not want to get a disease like measles, mumps, rubella, polio, things like that, but you don't want a bunch of people to get it, right? And then the people that are most susceptible to getting really sick getting it, or the more people that get it, some percentage of them are going to die. So if less people get it, less people are going to die from something. And we try to even eradicate something, and get rid of it completely. The only way to do that is to have much less people get it on a regular basis. So, talk about herd immunity and talk about immunization for this disease. There is benefit to a lot of people getting it and hopefully having mild illness. So then it's, eventually less people are susceptible to getting the disease, so it won't spread as much. But the limitation with that is, like I mentioned earlier, if it mutates and you can get it more than once, then now you really can't get herd immunity, because just because someone had it doesn't mean now there's someone that can sort of block the transmission from person A to person C, because person B in the middle can't get it. Now all of a sudden person A can give it to person B and then give it to each other back and forth. And so we don't really know how effective that's going to be. So as much as we all want to get rid of this as soon as possible and pretend like it doesn't exist, the idea that we can just let everyone get it, or let all the people that are low risk of getting it go out, let all the young, healthy people go out to bars, and let the people in nursing homes and stuff to stay away until we all get herd immunity and it goes away, it it doesn't look like, even though we hoped and maybe thought that might be a possibility early on, now we don't think that's going to happen because it's definitely not going away, and people are getting it more than once. So that idea is just not going to work for this like it may work for other things in the past. Usually you don't get like the measles or chickenpox a bunch of times, but this is different. This is like a cold or a flu where you can get it over and over and multiple times in the same season even.
That's very interesting. So that's another gem that you just dropped on us, that you can actually get this more than once. Well, that's something that I don't know that a lot of us even knew. I guess I want to ask Annie, with that being said, I'm going to ask the same question. Is this not just natural selection taking place where like it's survival of the fittest, where some of us are going to survive this and some of us just aren't?
I mean, in reality, that is kind of how it is. I don't know that is what it's meant to be, or the point of this, but there are people that are surviving it, and there are a lot of people that aren't surviving it. And it's to be in the hospital, to be in the isolation unit, if you are one of the unfortunate ones who become really sick and you end up having to make those decisions, either you or for a loved one, it's a really, really difficult way to end your last days. You can't have, for the most part, you can't have visitors. We make some exceptions for end of life, but we've had patients saying goodbye to their families with an iPad, FaceTiming, because we can't let a lot of people into the isolation units because it's just going to increase the spread. So it's really whether the natural selection theory is true. It's happening. Some people are surviving and some people aren't. So it's real, and it's definitely not a pleasant way to spend your last days.
The thing I'll say about that too, I definitely agree. Natural selection means if everybody gets a disease, the people that are technically the most fit or the most resistant to it for whatever reason, which may not know all the reasons initially, are going to survive. But the thing is, with every disease, you can do things to modify your risk. You can do things to avoid. You can do things to help fight it, right? So take, diabetes, for example. If you have 100 people that get diabetes, the weakest ones, meaning their body is less fit to handle it or they don't get care, some people are going to get worse disease or die. Some people aren't. But nowadays we have medicine, we have social services. So survival of the fittest, it depends on not just, what you're born with, but how much money you have, whether you have access to a doctor, whether you can get health care, how close you are to a hospital, whether you can, understand the risks that are out there, get the word out there. So this is good to help get the word out there. There's a lot of people that, speak other languages, don't have TVs, don't have ways of getting the message out to them, aren't being told things. And that affects whether or not you survive, whether or not you seek care, get the best care, get as good care as someone else. So those are all factors, just like behavioral factors, right? So if you go out and you don't wear a mask and you take all these risks and then you got symptoms and you don't go to the doctor and the doctor tells you to take treatment and you don't take the treatment, you're not going to have as good of an outcome because of all those things that you can modify.
Very true, very true. With that being said, I want to ask Nurse Annie here. I want to ask, should everyone, if we compare it to the HIV yet again, not to say that it's compared to HIV, but that's where I want to go with this. If it's in the same way we look at HIV, they say you should know your status, right? They say go get tested, so you should know your status. If you're going to have sexual partners, know your status before you go into the situation, so that way y'all don't have weird things happen when you go through your entanglements. But then, that being said, with this, should everyone be getting tested?
Well, I think the problem with everyone getting tested, you're tested on that day at that time, and you may or may not be positive. That doesn't mean you're not going to be positive a couple days later. So there's, I think, a time and a place for testing if you're going to have a surgical procedure, or I know some people are strategically being tested and quarantining if they're going to go hunting with a group of people. But I think testing when you are symptom free and you have not had an exposure isn't really going to tell you anything other than at that today you might not be positive, but it doesn't mean that you won't be positive in the next couple of days. So it might be a false reassurance if you're negative one day.
Okay. Dr. Sean, if I want to go see grandma, should I go get tested first?
Yeah, so to kind of add on to what Annie was saying, this day and age, the fact that you can have COVID, not have symptoms, and have a negative test. So you have it, but your test is negative, and you don't have symptoms, but you're still contagious, means everyone is potentially a walking COVID spreader without knowing it. So anytime you go see anybody, you could be giving it to them. That's kind of a scary thing, but that's, just the real basic answer. So should you go around people? Well, you may give them COVID. You never are going to be 100% sure that you're not giving somebody COVID. But, the other part of that answer is how long can we go on with being isolated and not being around our loved ones? And, they need our emotional support. They need sometimes caregivers for a lot of things, take them places, bring them things, check on them. And like Annie said, it's not just the hospitals, but nursing homes and assisted living facilities. You can't go and visit people. So, you're sitting here wondering, I hope they're okay. I'm depending on someone else I don't know who takes care of them to know that they're okay. And that's kind of scary, but a nice thing that a lot of times we are able to depend on those people. It says something good about our community that we're relying on other people to take care of our loved ones because we can't go see them. And we're hoping that they're being safe and they're getting tested and they're being honest about that, and everyone's doing what they're supposed to be doing without us being able to verify it ourselves.
That's a real raw, tough situation. You're right. A lot of people are going through that right now. As we know, Wisconsin is one of the highest infection rates in this, amongst all the states. We're one of the top. So it's just a real situation for especially Wisconsin here. I want to ask Dr. Sean, that being said, how did Wisconsin get so many coronavirus cases? How did we get to this stage?
Yeah, when you look over time of where the disease spread, you can look at how, where did the first cases start? How did it get into this country? And there's different theories that epidemiologists are trying to come up with, by boat, by plane, people traveling, did it come in the mail? And, that's all stuff that's still going to be figured out. We're probably going to study for years and hopefully get a better answer. But regardless of how that happened, it starts somewhere and then it spreads. So you have to look at travel patterns and close populations, cities where they're most dense, where people are closer together, where you have a disease that's spread by people being close together, you're going to have higher rates there. And then you can look at, what's been a lot of debate on the news too, and politicized again on, which places shut down first, which places had restrictions, who was following the isolation rules or not. The president, the governor, the local authorities, health departments, who was getting tested and able to be tested right away. The more you test a population, the more cases you're going to identify there. But if you're not testing other places, they could have as many cases, you just don't know about it. And you had asked, should everyone get tested? Well, it depends on, how many tests do we have available, and do we need to prioritize who gets those tests, and how many resources, staff and money and, testing facilities that can run those tests do we have available, where, it'd be nice if everybody tested each other every 5 minutes to know whether or not they have it. But if we don't have all those resources, we got to prioritize who needs it the most. And that means, the hospitalized patients, we're trying to decide if they need to go on a ventilator or should we send them home. So sometimes that answer is going to change over time based on those things.
Okay. That being said, shout out to the NBA. We just saw the NBA finals happen and it went off smooth. Congratulations again to the Los Angeles Lakers, but they took a bubble system, Nurse Annie, and in their bubble system, they ended up having 0% infection rate in that bubble. Do you feel like we should all be living in like but our own little bubble systems?
Well, I think that in the beginning of this virus, that was kind of the way that we flattened the curve, was to try to kind of isolate ourselves and slow the spread. I don't know if it's possible for us to all live in a bubble. I think there's essential workers that need to be out, and there's people that need to go out for essential things. So I think we just don't have the ability to live in a bubble like the NBA did.
Yeah, I guess when I say bubble, obviously I'm not meaning literally a bubble, but I guess I mean in our own small groups of friends or loved ones. I mean, should we really limit our circle? I mean, some of us have to do that anyways, but is this the time really to tighten up that circle? And
I think right now is the time to do it. The community rate is so high that I think anytime you go around, you're risking being exposed to it. So I think when the community spread is high, I think the only way to really protect yourself and protect your family and slow the spread is to try to isolate yourself and your family as much as possible.
okay. I want to ask Dr. Sean. Now, so much has been talked about vaccine. Like everything will be better in 2021. We're going to get a vaccine, and it's going to work out. You know, should everybody be getting a vaccine when it does arrive for COVID-19?
So I think the same situation applies for COVID-19 as it does for other vaccines that have gotten out there. And every time I give a prescription or a medication, it comes down to risk or benefit, and how much do we know where we can determine that. Vaccines, we know in general, are very effective. Usually they go through a rigorous process of being tested in experimental phases, and profiles of all the potential side effects and how common they are. And then we weigh that against who is the most susceptible to getting a severe illness or dying from the disease, and those are the people that should get it first. So if you have a really high chance of getting very sick or dying and low chance of side effects, you should get it. The concerns that I've seen based on hearing some of the things in the news and what some people are saying is that they're trying to rush it along and skip some of those safeguards, and that's concerning. And you can speculate, is it a political thing? Is it an economic thing? Is it just a fear thing where, hey, we got to get this out there because we need something that might help? I don't know. It might be a combination of the few, and depends on whether you believe people and what they say. And, the truth is none of us really knows, right? I mean, I analyze things. I go by evidence I can see. I don't really take anything by its word, but I get concerned when I hear people trying to rush things. And so I don't know. We'll have to wait and see what it comes out. But I would say if you trust your doctor, you have a good relationship with your doctor, and they recommend it, then that means something. But in general, you just want to make sure that a vaccine, has the potential to benefit you, has gone through the steps to make sure that it's safe and effective, and that it doesn't have a lot of high risks or weigh your risks. So if you're somebody who could get it and get really sick, or then I would say I'd probably step forward first rather than somebody who's probably not expected to get very ill from it.
That is a really touchy subject, because so many of us in the hood, we just, like you said, do you trust your doctor? So many of us, for whatever reason, have different beliefs when it comes to that in the medical world being on our side or whatnot. But that's a whole different conversation. Mainly with this coronavirus, I want to ask, there's been so many recommendations of the CDC. I want to ask Annie, for all of us who don't understand all this medical stuff, I mean, we've been spitting a lot of medical jargon and stuff, but for those of us who don't understand that, what exactly is the CDC anyways?
The CDC is the Center for Disease Control. They are the ones who release they do research, and they are the ones that kind of formulate the recommendations on how to prevent and treat diseases. So I think they're probably the key organization to give the recommendations and what we should follow for the diseases prevention.
So my question to you is, to follow up with that is, Annie, how would I know if I have COVID-19?
Well, you would go, if you have the classic symptoms, which are pretty broad now. So any type of sore throat, fever, body aches, any GI, diarrhea, nausea, headaches are now symptoms. Any type of those symptoms, you would want to reach out to your doctor, and they would recommend next steps if you should get tested, or what they would recommend.
Okay.
So you wouldn't know until you got tested if you had it.
You really wouldn't know until you got tested, right? Okay. I want to follow that up. I want to ask Dr. Sean, again, in the news, a lot of this has been talked about, but there's been a lot of chatter about that blood type matters when it comes to coronavirus. Can you speak on that a little bit if you know anything about that?
Yeah, I haven't seen any data that shows that your blood type, talking about like O negative or A positive, has a direct impact. We know that a lot of what separates this strain of coronavirus from other colds, which seems to cause very different, unusual, more serious side effects like heart failure, liver failure, those problems that kids are having, with their heart, strokes, blood clots, things like that, is because it seems to cause inflammation of blood vessels, what we call vasculitis. And that's primarily, we think, has something to do with your immune response or, inflammation. So everybody certainly has different susceptibilities to, having a larger inflammatory response than other people. Is, like an allergic reaction is actually a hypersensitive reaction where your immune system responds, stronger than it needs to, and kind of does more harm than good, by causing that inflammation. So certain people have certain, proteins, elements in their blood that make them respond a little bit more, with a little bit more inflammation, or not handle that inflammation as well. But not just blood type alone. I don't think I've seen where you go out there and if I'm O negative, I'm going to get a worse disease than somebody who's O positive.
Okay, so there's not enough evidence to say that blood type really is going to be what's the say all end all. Far as
I think it's something more detailed, which you can't really test for, or know much ahead of time.
Okay. I want to ask Annie then, with the way that Dr. Sean had mentioned that you can test for different things, but then like it could say negative. If we could test and it says negative, my question to you is, should we even be, should we trust how much faith can we put into the tests?
Well, I think most tests, or a lot of tests, aren't 100%. You'll always have false negatives, false positives. I think there's up to 30% of false negatives. So I think for the most part, you'll have an answer as to whether or not you tested positive or not. But there is always a chance that you might have a false negative. So that's why it's important to still follow the quarantine. If you have symptoms, you want to quarantine yourself for 10 days from the start of your symptoms, just in case you do have a false test result.
Okay. Yeah, Dr. Sean, I know personally some people who've told me that they went to get tested, but then never got the test, and then they said that they got a result back saying that they were positive, and then they said they never actually even took the test. They went to get tested, but never actually took the test. So, I mean, it's just so much jargon and political stuff around with this. And some people said they got the certain one. They tell me they have one type of test and another type of test, and they said they take this test and it's positive, and they take this one, it's negative.
Well, so early on, we were trying to get everybody tested, as many people as we could, to identify where this was, and what areas, because nobody wanted to close down. Nobody wanted to not be able to go to the store, not go to work. And we wanted to know where the quote unquote hot spots, where there's a lot of cases where we have to be careful, and I think the right thing, and it's shown now, after the fact, is that everybody should have shut down, because you're always behind the 8 ball, because by the time it's there, a bunch of people already have it. And part of the reason for that is there's this, they call window period, where you don't show symptoms, but you can have it. You can't test positive yet, and you can still be contagious. And that's the scary part. You can't see it, you can't smell it, you can't test for it, but you still have it. And you don't know how sick you're going to get. And that's one of the things that Jesse mentioned earlier, is she felt fine for like a week, and all of a sudden she got worse. And it's still hard to predict that, but that's what we're seeing a lot is, I had mild symptoms, or I only had a headache, I only had a fever, I only felt tired, and all of a sudden, somewhere between day 7 to day 10, the people that are going to get sick all of a sudden get much worse. And that's one of the benefits to testing early and then knowing what your risk factors are, is you can kind of be ready to handle it or be in the hospital, just before that happens, so that you're ready and you're not, all of a sudden really sick and not already in the hospital, or don't have a chance to call 911 or somebody around you that can see that you're sick and help you out. But the reason that you can have COVID and not get a positive test, is sometimes you don't have enough of the viruses that it creates a positive test. You have to have a certain number of, particles or whatever that test is actually testing for. Sometimes it's not always the virus itself. It's something that the virus accumulates in your body, and you have to accumulate enough of that for it to be sensitive enough to detect it. And that doesn't always happen on day one. So what we're kind of understanding now is, probably if you think you got it or you're around someone who had it, the chance that you're going to test positive is maybe 3, 5, 7 days later, but not 5 minutes after you're next to that person. So there's really no benefit to going and getting tested right after you walk by somebody who says, hey, by the way, I have COVID. You should really, let your doctor know, monitor for symptoms. And again, depending on how many resources we have, your doctor may tell you stay home if you're not that sick and just let it ride its course and go to the ER if you get worse. Or, we have plenty of tests, so go ahead and just kind of for a peace of mind, go get tested. But the fact that, you can still get a negative test means you still need to be careful. You still need to isolate. You still need to monitor symptoms. So, but the chances that are still low, even though it's possible. Right now, most of the tests are somewhere in the 90%, sensitive, which means if 100 people got tested that have a disease, it's going to tell, 90, 95% of those people, yes, you have it. And only a few people are going to get the wrong answer and say, you're negative. But so it's still very useful.
More accurate than not, is what you're stating.
Yeah.
Okay. All right. I guess final question is, can you be cured of COVID? I want to start with Nurse Annie. Have you heard that you can be cured of this?
Yeah, I think, a lot of people have COVID and they fully recover. So, but I think, like Dr. Sean said before, we don't know enough about it yet. You might be able to be reinfected. I don't think there's enough evidence with the antibodies and the mutations yet. So as of now, you can fully recover, but I don't think that we know exactly what that means for future, if you can reinfect or not.
Okay. I want to ask Dr. Sean the same question. Is this I've also heard that this might be something that just stays in your body,
Yeah.
Or is this something that you actually can be cured of?
Yeah. So I want to reassure people, like you said, not everybody trusts their doctors, and, nobody knows me, but
is this a fact?
When we say we don't know something for sure, it means we don't know 100% about it. We know a lot about it. We're pretty sure about most of what we're saying. And, there's always some uncertainty with anything, but I think we sound less confident or less knowledgeable about stuff in healthcare in general than we really are. And it's because we have to go into more of the details, to explain it further. The thing I can tell you in regards to this question is that we do know that you can get it more than once. That has been proven based on data. Unless someone's completely lying, making up the data, it's shown that you can get it. And what that means, the way we prove that is someone tested positive for the virus. They had a certain strain, which means, there's a lot of coronavirus mutations out there, but we can look at each mutation and tell the difference. And there have been people that have had one mutation, had a positive test, found it in their body, they had symptoms, they got better, they couldn't detect it, it went away, and now they've got a new strain of it. So, like I said, things mutate like the flu and the cold. You can get it over and over every year. It mutates. It's different. Every year, the vaccine for the flu is a little bit different based on the most common mutation forms of it that exist that year. And it seems like coronavirus is going to be the same thing, where the more times we get it, just like the more times we get the cold, you're probably going to get less sick because your body can't, doesn't have that way to fight that particular strain, but it knows how to fight the similar strains, and you can build a response to start fighting it sooner and faster than it did the last time you had it. So they think right now this is going to be something that you have every year. Just add it to the list of the other viruses that are out there that cause a cold and cause a flu. But it's not going to be something forever that we're going to have to worry about and get this sick from. It's going to our bodies are going to get used to it and adapt to it, so that we get less sick from it each year.
Well, that's good to know. Hopefully one day we will be able to see grandma again. But yes, well, I want to thank you, everybody, for joining the program. I want to thank our guest today, Dr. Sean. We thank you for joining the program. Tell the people again where they can find you if they need to reach out.
Well, you don't want to find me because you're either going to call the ambulance or go to the emergency department, but I work in several of those across southern Wisconsin.
Okay, so yes, you can find him out in the southern Wisconsin area. Hopefully you don't need him. Also, Annie, we thank you again for joining the program. You tell the people what you need to say.
I don't think you want to find me either because I'll be at the hospital in the inpatient area. But I am up in Green Bay and on Facebook.
All right. Well, we thank everybody for joining the program as well. As Jesse as well, who shared, we thank you so much for sharing your experience with us. We hope you guys don't get it. It sounds like many of you maybe already have, based off the numbers that we see in the Wisconsin area, but we just hope everybody the best. And we definitely say, masks seem to be somewhat of the key, but at the same time, as Dr. Sean said, it's not perfect answer. But we thank everybody for tuning in today. We feel like this is an important conversation. Hopefully, together we can learn from each other about this COVID-19. And actually, we do have to take this serious. I know I cracked a lot of jokes, but this is definitely a serious situation. This is definitely, people are dying. Over 200,000 people dying across the United States, and that's no joke. So until next time, everybody, we want you to stay safe. Is your boy Mizzle to the Jizzle. You're listening to Talk 22 on Radio 22. Until next time, y'all, I'm your boy Mizzle Jizzle. Peace.